Breast cancer, as I said, I'm a consultant breast surgeon and I work at Southampton General. Southampton is a city in England in the south coast, and that's actually the hospital where I really work. Now, what I'm going to talk to you about breast cancer and the awareness of this, the importance of it, is because breast cancer is so common. And I'm not just talking about, I'm talking about real people. I'm talking about women who are mothers, sisters, colleague at work, grandmothers who have this disease. It's very, very common. So it's the commonest malignancy, it's the commonest cancer that actually affects women all over the world. And about 2.5 million women are affected every year with breast cancer. The incidence of breast cancer is forever increasing. Now, it accounts for almost 23% of all cancers in women. It's the commonest thing that affects women. And so also, it's the commonest cause of cancer death in women. Of the over 2 million cases detected every year, you get about 700,000 women dying from breast cancer directly. Um, Now, back to the UK, the latest figures actually comes from 2021, and every year in the UK as a whole, we have more than 55,000 new cases of breast cancer diagnosed every year. And 15% of all newly cancer, it's 15% of all newly diagnosed cancer in the UK. So it's actually overtaking bowel cancer, lung cancer, and all the rest of it, which is why it's really very important. Now, within the UK, England is the biggest, of course, and about 46,000 women are diagnosed with breast cancer. Breast cancer is not just one entity. So because of that, you have pre-invasive cancer, which is actually lumped within that. And that's when it's still within the breast itself and couldn't have gone beyond the breast. If you look at it, some people will understand it if I say from the day a woman is born, 1 in 7 in the United Kingdom would actually develop breast cancer in their lifetime. Other parts of the world, we haven't got very reliable data. But if you look at developed countries, the incidence of breast cancer is highest. If you look at developing countries such as India or Nigeria, the incidence of breast cancer is also increasing. Whereas in the UK, women over the age of 50 accounts for 80% of all breast cancers. In developing countries such as Nigeria, women under the age of 50 actually account for more than 50% of newly diagnosed breast cancer. So there is something about breast cancer which we really don't understand yet, but it seems as if the rest of the world, as they're developing, improving technology and diet and everything, it seems as if the incidence of breast cancer is increasing in all those places too. Now, what are the things each and everyone should be aware of? I'm saying everyone. No, I'm not. It's not just about women because the husbands, the brothers, the sons also need to be aware of breast cancer because when it happens, when these women need to be looked after, people will be called in to help. So the commonest symptom women who have breast cancer present with is a lump, and usually it's a painless lump. It feels like a pebble in the breast. It's sort of firm, it's sort of not mobile. And if you felt one before, you would never miss it again. It's not like lumpy bumpy. Now, some women will notice sudden and excessive change in the size of the shape of their breast. So if a woman comes to the clinic and say they've had to buy new bras because their breast has increased more than 2 cup size, then it would ring alarm bells. Other women will have a change in texture because one breast feels very thickened. Some women would notice in the mirror, particularly when they go on holiday and they happen to look at themselves, they will notice puckering of their breast or dimpling of their breast. It's a reason to go and see a GP. Some ladies will notice a change in the color of their breast. It becomes quite red. The sort of redness is not just bruising. It's not like when you've bumped into something. It's not like when a woman has infection. It's a kind of redness which doesn't blanch. The breast might be slightly painful, and it's the kind of color change whereby you use antibiotics, it doesn't improve. Again, I'll show you a picture in a minute. It's something to actually go see your GP about. Some ladies will come to the clinic with rash on their nipple. Now, the nipple is that portion. I'll show you a picture of what I mean. Because having a rash on the skin of the breast itself doesn't necessarily mean it's something nasty. And another symptom, which is quite common, is nipple discharge. Now, the kind of nipple discharge that would make me think of something serious happening is if a woman suddenly notices spontaneous bloody nipple discharge from one breast and they can actually pinpoint where it's coming from, then it could be a sign of something wrong within the breast. And this is some of the pictures of women who've actually been treated for breast cancer. Over here, this lady actually presented to my clinic with very swollen pink breast. I'm not sure if you can see it very well, but she had dimpling on the breast. She had a very big lump, which turned out to be breast cancer. You can see the bulge on this lady's breast, and that's an abnormal lump. If you look at yourself in the mirror and you can see a bulge, then obviously you need to visit your GP. Now, the picture below shows the lady with redness of the breast. This is not infection. This is what we regard as inflammatory breast cancer. Now, there is nothing bad if your GP treats you with antibiotics. They will treat you with a course of antibiotics. But after 2 courses of antibiotics, if the redness is not any better, then it's high time to be referred to the hospital. This is another pic actually showing dimpling of the breast. And this is the sort of dimpling which is caused by a lump inside of the breast. And it's usually magnified if the woman raises up both hands. It pulls the skin of the breast inwards, and that way you know definitely or most likely there's an abnormality. Again, the other picture we have here is an example of a patient who has a lump in the breast just behind the nipple and is actually caused inward pulling of the nipple. Again, this is an abnormality, and this is a reason to go to the GP and be investigated appropriately. And this is an example of bloody nipple discharge. And you can see that the discharge is actually coming from the upper part of the nipple. This area of the breast is called the areola, and then you got the rest of the breast over there. Now, depending on the size of the breast of a woman, depending on whether they're perimenopausal or just before the period, the breast produces fluid all the time. And some women produce copious amount of fluid, which is yellow, and it's not necessarily a sign of cancer. So if it's non-spontaneous, if it's multi-duct, whereby you have discharge of yellow fluid from all over the nipple and from both breasts, that's not necessarily a sign of cancer, but a woman still needs to be aware. And if it's a problem, they need to go and see their GP. Now, this is a picture of a lady who's had a rash on the nipple, which has been neglected and gradually is actually spread to the rest of the breast. This is called Paget's disease of the nipple, and it's a similar case here. This next lady developed swelling of the breast, and over a 12-month period, the right breast became much larger than the left side. but it actually turned out to be a lesion which is not malignant. Now, what are the risk factors? Why are some people more prone than others to breast cancer? The truth is, we cannot give any one particular reason for a woman developing breast cancer, but obviously there are epidemiological factors that we know. Now, breast cancer is purely a disease of women, but men should still know about it. As I said previously, about 55,000 to 60,000 new cases in the UK, and all over the United Kingdom, men account for only about 350 cases every year. So in the last 13 years that I've been a consultant, I can only say I've treated about 4 men in total. Now, breast cancer is also a disease that affects postmenopausal women. In the UK, women over the age of 50 accounts for 80% of all breast cancers. The older a woman, the higher the risk of developing breast cancer. So women over the age of 70 accounts for more than 30% of all the breast cancers we see. When I mentioned the symptoms, I mentioned about lump, I mentioned about deepening, swelling, and nipple discharge. The other thing to say is that almost 35 to 40% of women diagnosed with breast cancer in the UK, because we screen, are picked up via screening, i.e. they're asymptomatic. So that's another thing to bear in mind. And it's something which I would encourage that every woman over the age of 50, as long as you're registered with your GP, you'll be invited. Now, another risk factor is nowadays, because of the improved diet and other things which we do, young girls are starting menstruation very early. So prolonged estrogen exposure actually increases the risks. So a woman who starts menstruation under the age of 10 and also delayed menopause, say over the age of 58, the risk of developing breast cancer actually increases. There have been many studies carried out, and it's been shown categorically that women who've never been pregnant, the risk of developing breast cancer is almost up to 30%. This is not absolute, but it's a risk factor. There have also been various research which have been published, randomized controlled trials, that's not conclusively shown oral contraceptive pill as a risk factor. But there is no doubt that HRT, hormone replacement therapy, actually increases the risk of developing breast cancer for those who take it for a very prolonged period of time. And I'm talking of more than 5 years use of HRT. Other risk factors include having had pre-invasive cancer of the breast before, or ovarian cancer in the past increases the risk of developing breast cancer more than 2 times. Now, a woman who's had breast cancer before is 5 times, carries a 5 times higher risk of developing another cancer rather than a woman of the same age and the same characteristics that has never developed breast cancer before. So also in the past, Hodgkin's disease, which is a disease that affects lymph nodes, particularly in young women, when they have ionizing radiation, the risk of breast cancer is more than 50%. It's not the case nowadays because there are other ways of treating Hodgkin's disease. But those who've had ionizing radiation in the past are monitored closely because of the risk of breast cancer. Excessive alcohol consumption also increases the risk of breast cancer, particularly in women who are postmenopausal. Family history of breast cancer. 85% of all those who develop breast cancer don't carry abnormal gene, but they have familial risk, i.e. they might have a mother or sister or aunties who've developed breast cancer. Now, if a woman has a sister, particularly under the age of 50, who's developed a breast cancer, then the risk is more than 2 times. This risk is higher with a sister developing breast cancer more than a mother who's had breast cancer. There are some women who carry abnormal gene. I mean, a lot of us might have heard about the BRCA1 and 2 gene, like Angelina Jolie. But all in all, it accounts for about 5 to 10% of all breast cancers. So it still goes without much saying that majority of breast cancer is actually sporadic. For those women who carry the BRCA gene, there's a BRCA1 and then there's a BRCA2. The lifetime risk of developing breast cancer is almost up to 80% in BRCA1 and almost up to 70% in BRCA2, which means majority of them from experience would develop the breast cancer before the age of 50. Now, if a woman knows family members under the age of 40, or maybe a sister who develops breast cancer, routinely in the UK, they will be offered the opportunity. Or if there's male breast cancer or a relative under the age of 50 who's developed bilateral breast cancer, or a relative under the age of 60 who's developed ovarian and breast cancer, you'll be screened for BRCA gene mutation. Now, and the recommendation for relatives of those who've developed breast cancer who are high risk because they carry BRCA gene mutation is they can be closely monitored, but they can also have bilateral risk-reducing mastectomy and prophylactic ovarectomies at the appropriate time. Now, for each and everyone, this is about breast awareness. How can you reduce your risk? Those 4 things are pretty much self-explanatory. Follow healthy changes, healthy diet, reduce alcohol consumption. For men and women, 14 units a week is maximum, but really excessive amount of alcohol, particularly in postmenopausal women, it's what's not desirable. Maintain a healthy weight, keep physically active. And for those who are young, still of the childbearing age, it's always a very good idea to actually breastfeed. And the way that helps is that it actually stops ovulation and it reduces estrogen exposure, particularly those who have children under the age of 23. So having children over the age of 40 does not confer any benefit. Now, this is the anatomy, and it's just to give you a brief idea. The female breast is mainly fat, but it does vary from one person to the other. The reason why I've included this picture is to explain to you, because some women will say when they try to examine themselves, it's quite difficult because their breast is lumpy, bumpy. The reason why is some women have lots of breast lobule, even up to the age of 70, whereas majority will have their breast, it will be 70% fat. But the idea with breast awareness is that each and everyone should know what their breast feels like, because if something was to go wrong, you will be the best person to actually find it. The easiest thing to do is for a woman who's still having period to examine their breast about 2-3 days after their period with the flat of the hand with soap or cream. Just by going up and down is actually adequate once a month, or to go round and round the breast to make sure you get to know what's normal for you. Now, if the breast is red and doesn't get any better, it's not that painful, you've had antibiotics, then obviously you need to go and see your GP. If you have spontaneous bloody nipple discharge, you need to go and see your GP. If you can feel a lump and you've never had a lump before, then it's also a good idea to actually have it checked. And also, I think there's a huge benefit for women over the age of 50 who are invited should attend for breast screening. Now, we can go into the benefits of that. There are also disadvantages in the screening. And the disadvantage is, you can pick up certain abnormalities within the breast that might actually not become cancer, or it could actually take more than 15 or 20 years to actually turn into something nasty, particularly in women over the age of 70. So that's where breast screening falls down. Now, this is the kind of test which we perform, and it's part of breast awareness. If a woman over the age of 40 has a problem with the breast, then they will have a mammogram performed. This is what it looks like, and it shows you the anatomy of the breast, just like the other picture which I've showed you. The landmark is the nipple, and then you have the breast tissue in there, and then the subcutaneous fat. Now, this is a young woman, but if there is breast cancer, it just appears white with tentacles. Although this screen doesn't permit us to look at it in detail, the radiologist, the consultant who looks at the mammogram, they have better screen and they can actually tell if an abnormality on the mammogram is abnormal or it's not abnormal. Now, some women will have their first mammogram, and because they're perimenopausal, their breast is tender, and it will be sore. Yes, truly it will be sore, and a lot of women will refuse to go again. But my advice is there are lots of benefit from actually attending for screening mammogram. The next time, what you could do is actually take painkillers before you attend and have extra painkillers which you can take after you have the test. The mammogram is the best test actually to pick up breast cancer. The reason why I say this is we have a few ladies, for whatever reason, would not want the radiation from a mammogram. The amount of radiation from a mammogram is so low. Some women would request that we perform ultrasound scan. Ultrasound scan is useful, but it's not sensitive enough. It's usually used in women under the age of 40 or to actually look at a pinpoint area within the breast. So it's not a useful screening tool. And again, I repeat, the radiation from a mammogram is negligible. Now, breast cancer, we have so many different modalities of treatment. The key treatment is surgery. Most ladies nowadays, unlike 20, 30 years ago, would actually be found with small breast cancer. And 95% of patients diagnosed with breast cancer would be able to have surgery. The aim of the surgery is actually to completely remove the breast cancer. If it's too big, if it's attached, if it's gone to other parts of the body, then surgery is not going to cure it. In addition to removing the cancer from the breast, we also remove a lymph node from the armpit, and that's to stage the axilla to check if the cancer is gone beyond the breast. More than 60% of ladies diagnosed with breast cancer in the UK would only need to have the cancer removed with a rim of normal tissue. Only a small proportion nowadays would need to have the whole breast removed. And the ladies who need to have the whole breast removed will be because they've got big cancer or they've got cancer and precancer all over the breast or particular type of breast cancer. Now, another modality of treatment is chemotherapy. All the other treatments, apart from the surgery, the aim is to reduce the risk of the cancer coming back. So about 30% of women with breast cancer would have chemotherapy. The chemotherapy treats the whole body, and it helps to reduce the risk of the cancer coming back. Radiotherapy is like surgery. It's another local treatment, but it's given after surgery when the wound is healed. And the aim of it is to reduce the risk of local recurrence. Now, hormone therapy is given to about 80% of women who are diagnosed with breast cancer because the cancer will be hormone receptor positive. 20% of breast cancers we see in the UK are hormone receptor negative, which means they won't benefit from hormone therapy. There are many other types of treatments which is used nowadays actually to treat patients and to keep survival up, like Herceptin, which is antibody treatments used for about 20% of patients who are HER2 receptor positive. Now, this is a case of these pictures I'm showing you now are examples of patients who've had breast cancer, they've had a mastectomy, and have performed breast reconstruction. So the first case is a lady who had right breast cancer, and you can see she's actually had implant-based reconstruction on the right side. I'll go back. This other lady has had left mastectomy, and she's also had implant reconstruction, and this is her addressed. So she's had a treatment, she's completed her treatment, she's stressed, and that helps actually to improve our well-being, our social well-being, our sexual well-being, our interaction with the family. Yes, it's true. If she's naked, it will be obvious she's had breast cancer, but when she's dressed, actually, it's difficult to say. This is another picture of a young lady who had pre-cancer in the whole of her right breast, and I performed mastectomy on the right side and implant reconstruction, and she's also had augmentation of the left breast to actually make her equal. And the picture on the other side shows her when she's wearing a bra. I mean, these are some of the good pictures of ladies who've had treatment for breast cancers and have had the breast reconstructed. This is another form of reconstruction. This lady had a large cancer in the left breast, and I performed a mastectomy and latissimus dorsi reconstruction, which is whereby we take skin and muscle from the back and swing it to the front and use a small implant. Because she had large breasts, I've reduced the size of the right breast and also performed a lift. And this is her in a bra. The reason for showing you this picture is actually talk about survival. In the UK, survival from breast cancer is ever improving. Majority of our ladies actually survive breast cancer. So 9 in 10 women will survive breast cancer for more than 5 years. Now, this is said this way because we only keep this record for a period of time for research purposes and also for presentation. What it truly means is a lot of them will survive more than 5 years. And survival is improving. And it's doubled in the last 40 years. And that's with the advent of screening, which means majority of cancers are picked when they're small, is also as a result of new modalities of treatment, new forms of chemotherapy, and the way we look after women, it's changed vastly. It's moved from the old days where you have a general surgeon doing bowel surgery and doing breast cancer. Nowadays, we have specialist units all over the country where you'll attend, where you'll be looked after. You have breast care nurses also looking after you, and you can always give them a ring to find out about it. The prevalence tells you about the number of women in the UK who've actually had treatment for breast cancer, and they're living with it, and they're doing very well. Say that about 20% of the breast cancer we treat would have aggressive breast cancer. Majority of those who will die within the first 2 years. But the good news is breast cancer, although it's very common, majority of women will have relatives who've had breast cancer, but majority do very well. Lastly, the prognostic factors of those who won't do as well will be those who've presented late, those ladies who have disease in the lymph nodes at the time of presentation, those with very large tumors, more than 3 centimeters in the breast. There is a type of breast cancer which can be very difficult to treat sometimes, particularly if they don't tolerate chemotherapy. It's called triple negative. Those with grade 3 cancers or combination of this also have worse prognosis. For those who are listening to us and not in the UK, it's important to point out that, yes, the incidence in developed countries is high, but the incidence in developing countries is actually galloping. Whereas in the UK, majority of ladies developing breast cancer are over the age of 50. In developing countries, majority of them are under the age of 60. The survival in India, 5-year survival, is about 70%, whereas in the UK is over 84%, close to 90. In South Africa is about 50%. And it's really a combination of the fact that the level of awareness, the diagnostic tools, and also treatment available. So if I don't leave you with anything, one thing I want to leave you with is that you should know yourself. You should know what your breast feels like. If you have a problem, go to your GP. But breast cancer is not necessarily a death sentence. It can be treated. It can be managed. Thank you very much.
Thank you so much, Mr. Odafin. Absolutely amazing session. And you mentioned about new lumps in breasts and on the and also the thickening and swelling of the breasts. And you mentioned about redness and flakiness around the nipples. We're going to open up for questions and answers and comments. So let's see if there's anything in the chat box.